Hello guys, in the last video we have discussed about some of the allergic diseases. Now today let's talk about some of the most common non-allergic or infectious skin disease in our pets. So if you notice your dog is having severe itching with redness, red small tiny bumps or small flat discoloration mainly on the abdomen or under the neck or at the axillary part or at the groin area as well as the face and extremities, and as the time passes the lesion become greasy and the whole color is turned black giving an offensive odor and a diffuse hair loss, then it could be a fungal disease we often called as Malassezia dermatitis. So Malassezia is basically a lipid-loving fungus which is normally found in your dog's skin, hair coat, but as your dog's immune system got compromised, also with the concurrent allergic dermatitis, your dog's skin becomes susceptible to Malassezia dermatitis. So as for the treatment of the Malassezia dermatitis, we should go with the topical and systematic antifungal drugs. In the severe cases, ketoconazole is an ideal systematic drug to control the dermatitis. We also have the alternative itraconazole, and this therapy should be continue at least 3 weeks to see the result. As for the topical agent, there are so many shampoos are there in the market with the ketoconazole, miconazole, and also with chlorhexidine, and you should use it 2 to 3 times in a week to see the result. Also, there is one thing that even there is severe itching in the Malassezia dermatitis, you should not use corticosteroid due to the high risk of rebound infection. So moving further, let's talk about the bacterial infection or Pyoderma, which is more common in the case of dog than the cat, and which is secondary to the other allergic dermatitis like atopic dermatitis or flea infestation and adverse food reaction. So basically, Pyoderma is caused by the overgrowth of the normal resident microflora on the dog's skin, Staphylococcus intermediate, and Pyoderma could be superficial or deep, depending on the depth of the infection on your dog's body. So warm and moist areas such as skin fold and interdigital space has higher risk of getting bacterial infection, and you might notice there are small red tiny bumps, or there could be a itching or a redness or pustule. Sometimes crust formation is there, and especially on the face, extremities, and trunk area. So with the severity of the infection, there could be a pain, swelling, or a smell, or blood and pus may be drained out of the lesion. Now let's talk about how to manage this bacterial infection. So a minimum 21 to 30 days of antibiotic course is essential to control the superficial bacterial infection. If your dog getting the bacterial infection for the first time, you should start with the empirical antibiotic. There are so many antibiotics out there which helps to control this bacterial infection. And again, if there is a deep pyoderma, then there is an ointment which will helpful in treating this deep infection, such as 2% mupirocin ointment is quite helpful in this kind of infection. Along with the systematic antibiotic therapy, you should give at least 2 to 3 times bath to your dog with the antibacterial shampoo containing chlorhexidine or like containing benzoyl peroxide, which will help to aid in the controlling of this bacterial infection. So after the bacterial infection, now let's talk about the mange infestation. Now let's talk about the mange infestation in the cats. So if you notice your cat is shaking its head and scratching continuously at the ear with the dropping ear and pus is coming out from the ear, then it could be a mite known as Otodectes, which cause otitis externa in the cat. Or if you notice a crusty lesion with hair loss at the ear or at the head or at the neck, then it could be a Notoedric or Demodex infection. There's another mange which often called as a walk-in dandruff cause scale and crust formation mainly on the dorsal part of the body with miliary dermatitis. So in the all above conditions, using lime sulfur or pyrethrin dipping weekly for at least 6 to 8 weeks will help to control this mange infestation in the cats. So in the dog, mange infestation include the Sarcoptic scabies and Demodicosis. So scabies is highly contagious and genetic dermatosis of the dogs, which is caused by Sarcoptic scabies or canis. So if you notice your dog is having severe and constant itching with the redness, papules, pustules, especially at the margin of ear pinna, or bony prominences like elbow, hook, which is followed by the chest and abdomen. And as the time passes, there will be the crust formation, alopecia, and there could be skin abrasion. Then it could be suggestive of having scabies. After some time, these lesions become hyperpigmented. There will be the lichenification, and it will lead to the ear infection in the dogs. To differentiate this mange infestation, we generally perform pinna pedal reflex, which is highly suggestive and almost positive in 80% of these cases. So this condition is topically treated with the amoxicillin or selamectin spot-ons and acrucidal dips like amidras or lime sulfur 3 times at the 15 days interval, along with the keratolytic shampoos which containing the benzoyl peroxide and salicylic acids. Systematically, ivermectin is quite useful using 2 to 3 times at 15 days interval to control the scabies. So another mange infestation in dog is the Demodex canis, which is a normal resident in the hair follicle and sebaceous gland of the dog. So the nutrition level and the immune status of the dog with the underlying internal diseases such as hypothyroidism or hyperadrenocorticism will lead to proliferation of this Demodex. So in the case of demodicosis, there is no itching unless there is the involvement of secondary bacterial infection. There is redness and focal alopecia on the face, especially around the eyes or lips and on the front leg. So as for the treatment of demodicosis, there is a necessary treatment with the ivermectin systematically and orally once in a day with the keratolytic shampoos and acrucidal dips like amidras. So this is all about the common skin problems in dogs and cats we have discussed so far. And if you find this video helpful, don't forget to like, subscribe, and comment.